Hello and welcome to Clean Talk Live. I'm your host, Brad Whitchurch, and we're coming to you live from Florida. It's 3 p.m. Eastern time on Wednesday, and we're here to talk infection prevention and infection control. Be a part of our community by joining us at cleantalk.tv and be sure to register on YouTube and hit that like button. Joining us today is a friend of mine and a special guest, Mr. Phil Jalbert. Phil is a territory manager in the Canadian territory for Seal Shield. Phil, welcome to the show.
Thanks, Brad. Happy to be here.
Well, we're glad to have you on the show. Phil, why don't you tell us a little bit about your background and how it is that you came to be on Clean Talk today?
Sure, sounds good. So, I've been in the IT channel here in Canada for about 15 years. I started in the distribution space, doing a lot of marketing and events. My passion was really in sales, and I found that while doing marketing, found that while doing some of my retail experience as a teenager, and as a lot of us try. And as I kind of rolled into, the vendor space, working for different manufacturers, selling a whole different suite of products, trying to find kind of that niche of something that spoke to me and what I think matters, as opposed to just trying to chase some dollars. So, I sold printers, I sold cables, I sold accessories. And actually, when I started working for Ergotron about 6 or 7 years ago, I started getting exposure to the healthcare space and selling sit-stand desks and talking to people about ergonomics, but then also talking to hospitals, going to these cart fairs, doing a lot more work within these facilities across Canada. That exposure really kind of opened my eyes to, wow, there's like a really big need for specific products in here. And the sales cycle is different. The conversations are different. The purpose of what you're doing is different, whether it's selling, our portfolio of products, which really makes an impact on how they can keep people healthy, or selling something like a cart or a monitor. You're really contributing to, people who do really good work to help keep us safe and keep us healthy. And that really opened my eyes to it. So I kind of stuck around. And then one day came around, I was, plopping around on LinkedIn, and I saw a post about a job opening here in Canada. And I reached out to Steve here internally, and we had a nice conversation and kind of went back and forth for about a year, talking about all the different things and seeing how we could expand Seal Shield into Canada. And then had a couple of people come up, meet me, Bill and Scott and Christian. Actually, we had breakfast one morning and decided it was good to go and hit the ground running. And I've been doing it now for just over 3 years. It's been one of the most rewarding, jobs I've had in my 15-year career. It's been something that given me a lot of exposure into things that I didn't know existed, talking about the infection control, getting into events where I'm not just trying to get people to buy a product, but I'm talking about solutions that make a difference, and talking to people who spend their lives worrying about infection control and infection prevention and showing them products they didn't know existed. And a little side story, I remember my first year, probably my 6th month in at Seal Shield, I went to an infection prevention and control event in Quebec. And, there's 2,000 plus members of this group, this big event, and I'm the only guy there selling stuff like keyboards, talking about the electroclave, showing off our screen protectors. I'm standing next to people selling infusion pumps, people selling, $100,000 solutions. And there's people coming by the booth looking at me like, why are you here? You have keyboards. And then you start to talk to them about the story, tell them where we came from, tell them why we're selling the product. And you just see light bulb after light bulb after light bulb. And it went from, this kind of nice niche business to kind of the booming thing that we have now, where we're standard in almost every health authority across the country just over the last 3 years.
Well, Phil, you mentioned you've been with Seal Shield for 3 years now. That really gives you an interesting perspective on the infection control market because you have been involved with it pre-COVID, during COVID, and where we are today. And that's why we wanted to have you on the show today, Phil, to talk a little bit about the experience in Canada, how Canada is being affected by COVID, the actions that the Canadian government has taken, and how it's affected healthcare systems as well as patients within the healthcare system. So you've done a great job of expanding Seal Shield's market into Canada. And I know there are some differences between the US and Canada and how the two countries have dealt with the COVID pandemic. What can you tell us about your experiences in Canada that maybe some of our viewers here in the United States aren't aware of?
Yeah, no, I think that's a really good point. I mean, the way that Canada, I think, is viewed internationally and even internally here, people see us kind of as, we're the nice hat on top of the United States. We're nice, we're friendly, we love maple syrup, we love hockey. We love saying sorry. We say a, even though it's not as true as it may seem. It does happen. But as COVID kind of kicked off and we started to lock down and realize the severity of what was happening, you felt this kind of sense of community, whether it was pre-vaccine or post-vaccine, people were really interested in trying to do what was right. So there wasn't pushback when we were told we needed to lock down for 2 weeks. Everyone was happy to stay in their homes. People kept their distance, when the grocery stores started, metering the amount of people coming in, and you had to wait outside in line, even though it might not be the warmest day. I never saw anybody arguing or fighting or mad about it. And, this is pre-mask mandate. And this kind of took place across the country, and it was interesting to see us come together. But then as time kind of wore on, you kind of saw this divide that took place province by province. And one of the first ones that really took hold to me as, oh no, we're into something different here was, the eastern provinces, the Nova Scotia, New Brunswick, Newfoundland, Prince Edward Island. They decided to create their own bubble, where they actually locked down those 4 provinces so you could only travel within the 4 provinces. And I had some customers there that were buying our electroclave. I had an ambulatory service who had purchased 10 units. And I wanted to go there, see them, help them install, help them train. And I had to apply for an exemption from the province to enter. So had I gotten on a plane and flown there, they would have denied me entry into a province that took me an hour and a half to fly to, a place where I have great friends, a place that just seemed, like a nice place to go. It didn't seem very Canadian to say, no, you can't come here.
And you're going there to install infection control solutions, right? That's the irony of this story. Go ahead.
And it took me three months to get that exemption paper and get off the plane. They give you all of this stuff to tell you what you can and can't do there. And I try to go up to restaurants, and they're calling you every day. Someone from the government's calling you to see where you are. They're trying to do contact tracing. And that was kind of a turning point where I was like, oh, this is weird. And then it started to happen in Ontario. We came in with in which I was living at the time. They came in with the mask mandates. They came in with all the different, kind of lockdown scenarios. Quebec went even further, where they really locked down. They put in curfews for 10 p.m. that if you were out past that time, you could only go out to walk your dog within a 4-block radius of your house. Police were stopping you, taking you home.
Now, let me interrupt you. So what time frame are we talking about here? Because you say 2020, everybody's joining together. We're in this together. We're going to get through it. And then some more restrictions start to come into place. Is this the way it is now? What kind of time frame are you talking about?
Yeah, so that was, I'd say we started to lock down, March, like everybody else. Things started getting weird. And then kind of by summertime, that June, July timeframe, things really started to get serious. The lockdowns really took hold. It wasn't as bad until winter rolled around, and they're like, okay, we really need to hammer these in, closing things down. I mean, I remember there was no basketball up here. As we are both big basketball fans, they sent the Raptors down to Tampa Bay to play 2 seasons, which was just crazy. I mean, just on that, they only opened up arenas for fans for basketball yesterday. It was the first time the Raptors had played in front of a home crowd in almost 2 years. And we just saw this kind of weird mentality start to take hold of, we're in control now. We're going to tell you guys what to do. And in the beginning, it kind of fell within the science. But as the science changed and the vaccines came out, we all got that hope again. So now we're kind of in that back half of the summer. We're going into the fall and the winter time. And now we're talking about vaccines. Now we're talking about reopening, getting rid of masks. And some provinces, like on the West Coast where I am now in Vancouver, they didn't put mask mandates in place. They stayed away from that. And the numbers, didn't warrant going down a deeper path. So it made sense. But when you actually start to look at, how the kind of kumbaya feeling that we had in the beginning turned into, oh no, we're going to tell you what to do. It was like a year time period. So kind of March 2020 to March 21, it became this, oh no, now we're going to tell you must wear masks. You must do this. We're going to lock you down. They reinstituted, they kind of took some of our freedoms away, gave them back, took them away again. even going so far as to having Quebec reinstitute the the curfew and taking away that you were allowed to walk your dog. So from 10 p.m. till 5 a.m. in the morning, you were not allowed to leave your house. And it didn't make a lot of sense, and there was a really high uptick of vaccines. Everybody was doing it. I think, we have a population of 38 million people. 30.9 million of those 38 are fully vaccinated with 2 doses. Yet we still sit in this place where we have mask mandates, we have vaccine passports, and we came up with the boosters, and I think it's only 45% or so of Canadians actually went and got the boosters. So there's this big decrease in people trusting the vaccines because we all were sold on the idea of do it for the greater good. We're going back to normal. Well, normal never came back, and it's been 2 years.
Well, I tell you, being here in Florida, some of these measures sound certainly draconian, but a lot of the world is taking a similar stance in the way that they deal with COVID. As you know, the CDC just revised their guidelines here in the US and have identified regions based on their risk. And so the appropriate mask recommendations are being done by regions based on the number of new COVID cases in hospitals and other metrics. Where is Canada today? You mentioned that basketball started yesterday for spectators. Is this a change in other areas as well? Where's Canada today in this process?
Yeah, I'm hoping that it's the beginning of some real change and some real, kind of restoration in the freedoms that we all like to enjoy. And as of yesterday, we had a couple of provinces, Alberta and Saskatchewan, both came forward, and they're removing their mask mandates. They're removing the vaccine passports. We're seeing Ontario, which is the most populous province, has about 44% of our population. They're about to remove their vaccine passports. They're allowing it to be not mandatory, but voluntary. So if you want to be in a restaurant and have a vaccine passport, you're allowed to. But at least we're starting to see some of these things roll back. British Columbia, which was kind of on the other side of things, where they weren't going down the mask path. They were a little bit slow on the passports. And then they kind of reversed course, and now they went a bit too far. They're kind of the last province to recognize that we need to follow the science, that this is not a pandemic anymore, that this is an endemic, and that we need to kind of move into a new stage of what we should expect. So we're hoping next week that they'll release some new guidelines to allow people to go back to normal. And I mean, I take my kids to skating or something, and you see these little kids wearing masks, and it's just, we're doing a skating lesson. Why do you have your 5-year-old wearing a mask? It just, we need to go back to some sense of sanity, I think, in that regard. And just to your point, I mean, I traveled down to Florida really early in the pandemic back in 2020, and it was weird. It was very odd because I got to the airport here in Toronto, and there was probably 6 people on my plane flying south. I had to connect through Charlotte. I got off the plane, and I went from an airport that I'm used to being, this bustling major airport, in a metropolitan city like Toronto, to being in Charlotte, getting off and seeing this absolutely packed full airport. Every bay's got a flight going somewhere, thousands of people wearing masks, not wearing masks, and I actually froze. I felt like I was walking through a time machine or into a zombie apocalypse. I didn't know what to expect. And then coming down into Florida and having this experience where, I mean, we went to a game together. We saw the Raptors play the Magic, and we saw some great basketball, but there was maybe 100 people in there. Half of them were Raptors fans, which I liked, but it was weird to kind of get that experience and see that there is the ability to continue to live a life that's fulfilling, that isn't being dictated by mandates and, government rules, that you can still enjoy yourself and be safe. And I mean, to that point, I still haven't gotten COVID. It's been over 2 years. I've never gotten sick despite all of the potential exposures I've had. I've had about 20 some odd PCR tests just to come to and fro, get on planes, despite being vaccinated. I'm hoping it'll end soon.
Well, I have a sense of what you're talking about from the other perspective, because being here in Florida, a lot of us forget the kind of challenges that others are facing internationally and even within the United States itself. I've also been surprised when you leave Florida and you get to the airport and all of a sudden they're like, oh yeah, you ain't in Florida anymore. You need to wear a mask now. Oh, okay. And then you go to New Orleans and, you have to show your Vax card to get a hand grenade on Bourbon Street. And being in Florida, you forget that so many regions of our country and internationally are taking a much stronger stance on the COVID position. We do have a question, Phil, and I guess this is the $1,000,000 question. When do you think places will begin to fully open up in Canada? I guess if you could answer that, you could write your own ticket. Any sense on when things are going to come back to normal, Phil?
I feel like there is this, hope that's come forward over the last couple of weeks that we will see a lot of these measures go away. We will open up to some degree, having, the ability to go to concerts, to games for kids to graduate from high school and have their friends and family there. I think that's going to happen. The thing that I'm concerned about is what happens when the winter comes back around, because we have this sense of indoor spread, kind of being the problem, which, the science doesn't really support. So we've always taken this measure of summertime, we're going to open up, and wintertime, we're going to lock back down. So while the language that's coming from the provincial governments is we're going to loosen these restrictions, they also say, but they may come back. Don't be surprised if something else happens and we throw masks back on your face, or we tell you can't go, celebrate with your family again. And I'm hoping that isn't the case. I hope that, we can finally start to walk away from some of this mess, but it's becoming more difficult to be optimistic about it when it's been 2 years of the same.
And how are these mandates and these processes affecting the people? I mean, what is the net result of this in terms of, community satisfaction? And I know you've mentioned that there's a little bit of chaos in Canada amongst the populace. What can you tell us about that?
Yeah, there's definitely been some chaos. There's definitely been, kind of a depletion of that Canadian way, that kind of happy-go-lucky, apologetic Canadian is kind of, they're not there anymore. There's been a lot of people who have been stuck at home, people who don't have families that they can rely on for social, conversations, and they're stuck. And you actually saw a lot of people move. So I think a lot of communities have changed. I was looking at some numbers over the last few days, and, it's twofold. Part of it is people looking for something different, realizing that being stuck in a city, in a condo, is not sustainable and not suitable to being locked down. But also our housing prices have skyrocketed over the last 2 years. Just since March 2020, the average house cost in Canada has gone up $200,000. So in your major cities, your Montreal, Vancouver, Toronto's, a small home, whether it's a detached home, a semi-detached, a condo, you're looking at about a $1.4 to $1.5 million average price to live in, one of the three major cities in Canada. And you're looking at an average house cost around $780,000 for a typical average house anywhere in the country now.
Well, let me ask you about that. To what do you attribute that? Because are more people coming to Canada? I know that in Florida, our real estate prices have gone up dramatically, and we blame the New Yorkers and the Californians. Are more people moving to Canada in the face of these restrictions? To what do you attribute the increase in real estate?
Yeah, no, I think it's the opposite. We've had a lot of people leave. 64,000 people left Toronto alone to go to other parts of Ontario, to go into the boonies, an hour or two outside of the city. 37,000 additionally moved out of the province, whether it's another province or another country. 40,000 people left Montreal. 90,000 people have emigrated outside of Canada in the last 12 months. We had an increase in population on the West Coast because at the time, I came here just over or almost a year ago because the rules here were less, even though the cost of living here is very high. They didn't have mask mandates. I could still go to the gym. I could still see my friends. I could still go to a restaurant with my family. And then they peeled that away. So even though all these people are leaving, we have some strange real estate laws here that allow developers or real estate, professionals to purchase properties and then flip them. So you've seen countless stories about homes being purchased, 6 months ago. They put a fresh coat of paint on it and then sell it for $200,000 more than they did 3-4 months ago. And it's become this really kind of dirty trade that's really driven the house price up and forced anybody who makes less than $120,000 a year unable to purchase a home. So I've seen, numerous stats about the percentages of people under 40 who assume they will never be able to buy a property in Canada, which is terrifying. I mean, that's the American dream. It's a Canadian dream. You want a house for your family, a place to call home. And right now you can't do that. And even immigration, from outside countries has dropped about 80%. And some of that's the restrictions on getting in here. And some of that is just people not wanting to come and deal with the restrictions we have. And then we actually had about 87,000 non-permanent residents leave Canada who had immigrated here, and they've left to go back home because they didn't want to deal with how, our world was being changed.
Well, Phil, Clean Talk is an infection control platform podcast, and we do have another question. One of our viewers asked, do you think that there are better infection control protocols being used in Canada versus the US? And what are some differences that you can give us some examples of?
Yeah, I don't know if I would say that it's better or worse. It's different. The way that our healthcare system is structured here, it's a social system. It's funded by the government. You have to go through the process at a provincial level. One of the benefits of the size of our country is that you can have, the infection prevention and control boards, and they have certified members who work in all the hospitals, in long-term care facilities, all across the country, even in universities where, we're teaching the next round of doctors and nurses. So I think that it's easier for us to see a, province-wide. I'll take the example of British Columbia. When I came into the province here and I was talking to the health system at the provincial level, you're talking at, 200 plus hospitals across, the greater lower mainland. And if you can convince them that this is the right path for them to help them keep, the workers in the hospital safe, keep the patients safe, visitors safe, and they believe in what you're doing, you can show them that the solutions you're putting forward work, then when they institute it, it goes wide. So when I say that we're standard in most healthcare systems here, if you lock into the provincial health systems in British Columbia, you go to every hospital and they're buying our keyboards, they're buying our mice. They standardized on our electroclave last year, and we're in 25 different hospitals across Vancouver. And we've physically gone in there, with one of our fellow Clean Talk podcasters, Norm, and done the work in person to show them that our electroclave works and show them that our products work. And now it's been, and they started to bring this on pre-COVID and have only accelerated since. So, in the United States, from what I've seen and what I hear, the private healthcare system, hospitals buying kind of per site as opposed to doing it statewide. I think that's one benefit we have. There's obviously benefits to it. Taxes are super high, which is not my favorite part, but I can also go to the doctor, when need be, and not have to worry about going broke because of it.
Well, Phil, you mentioned the electroclave, and of course, the electroclave is the Seal Shield UVC disinfection system. In the U.S., as you know, UV light is largely regulated by either the EPA or the FDA, but Canada has its own regulatory system. Can you talk a little bit about that and how they're looking at UV light as a potential disinfection modality?
Yeah, absolutely. So, kind of early in the pandemic, and going back to that, event that I referenced earlier in the podcast, when I went to that event, there was no other UV products there. There were other companies that carried UV, but they didn't display it because it just wasn't something that people were educated on or looking for. And pandemic hit and it became, everywhere. And all of our partners were selling it. All of our customers were looking at it. And it became this kind of Wild West, which I'm sure was the same in the United States. Health Canada at the end of 2020 kind of put forward this idea that they were going to regulate the market, which I think is the right play. You want to make sure that what you're doing is doing what you say it's going to do. You get a lot of flashlights, get a lot of knockoff products, get a lot of even well-known vendors come up with some solution that didn't really work. And as soon as this order came out, I'd say 90% of them disappeared. They came off our partner websites. I stopped seeing them being, marketed. You stopped seeing them out in public, even on Amazon. They just disappeared, which I think is a good thing. And, based on some of what we do and what some of our competitors do, it puts us in a nice position to actually have, a solution that fits within what Health Canada needs to have a regulated product. And it hasn't become, a hammer yet, but it will happen one day where it will be an official, you must have some type of certification, whether it's a medical device license or a pesticide license to sell UV products here. But luckily, at least in the interim, it has taken away a lot of those kind of knockoff products that don't do what the electric wave does, with our disinfection cycles.
What other differences do you see between U.S. healthcare and Canadian healthcare? And what do you see as the future, or what would you like to see as the future for Canadian healthcare post-pandemic?
Yeah, I think that, some of the stuff that's happened during the pandemic has been good, seeing the infection protocols really increase and really not just be stuck into certain departments within hospitals. They've taken hold kind of across the entire facility, and they've gone out into, your own doctor's offices or your dentist's office. And I think that's a positive, seeing some of these things come into place, using our keyboards, using our electric wave. I think that's good. I think that there's been some loss of confidence in our healthcare system. And even still, people go across the border to the US to get procedures done because it's easier. They would rather pay out of pocket to go get an MRI than wait and do it here. And, some of the ways I've had some friends who've had some pretty serious illnesses take place, and, they've had varied care, whether it's because of COVID or just because the way the system is structured here. They're not getting the care that they deserve. And I think that kind of pay-to-play system keeps people a bit more honest, which, is one of the things that I think the U.S. does right. It's bad for some, it's good for others, right? If you can afford to go get the type of care you need to help yourself, then you can go get it. In Canada, it's not as easy because the way it is, doesn't matter if you go to a hospital in Toronto or a hospital in Halifax or Vancouver, you're going to get a pretty similar experience. The benefit is you're not paying for it. You can go in, whether it's, for chemotherapy or because your kid split his chin, you can go in there, get care and leave. And there's no bill that follows you out the door. But it would be nice to just see some of the faith restored in the system here. Because in the beginning we had, people cheering on healthcare workers as heroes. And then, the trucker convoy happened and you had people, they had actually a bulletin put out in Toronto telling healthcare workers to not wear their scrubs to work or to leave their work wearing scrubs out of fear of violence towards them because
Wow.
they're kind of taking some of the blame for the mandates.
Wow. I did not expect that. That's an interesting perspective. Appreciate you sharing that with us, Phil. Now, Phil, I know that you are a proud native Canadian, but you're going to be down here visiting with us in the next week or so at the HIMSS Healthcare Information Management Systems Symposium in Orlando, Florida on March 14th. That begins. Tell us a little bit about the HIMSS show and why that's an important trade show for you and why you're attending.
Yeah, no, I'm quite excited to come down to HIMSS. It'll be my third HIMSS now, I believe. The first one I did was in Orlando. We did Vegas last year. And I think, from a healthcare perspective and from a vendor perspective, it's great to get out there to see what else is in the market, what other people are building, how the healthcare systems are transforming. There's a lot of stuff that happens at HIMSS and in the healthcare systems in the United States that later get adopted in Canada. So you kind of get a future preview of what could come into your own healthcare systems. And it's great to see, people come down. Unfortunately, the international presence is not as strong as it was from my first year coming down. And I think some of that is just some fear still around COVID, around travel, around the restrictions. They did kind of make you afraid that you would get stuck if you crossed the border, which has happened to me. But, coming
right,
down
that's a rational fear, right? I mean, what do you expect when you're traveling? Give us a little sense of what you expect you'll have to put up with as you travel down to Florida next week.
Yeah, luckily they just changed the rules to travel across the border. Previously over the last 2 years, it was a PCR test had to be taken 72 hours before you crossed the border. And then once again, when you came home. So those 20 plus tests that I referenced earlier, is a lot of being stabbed in the nose. And it's not comfortable. It costs a lot of money. It's all out of pocket. You're paying $200+ each time for the pleasure of having somebody stick a swab in your nostrils. So luckily that's loosened up a little bit. So I'm hoping it's a bit smoother, but the confusion around the rules, has created headaches for me, some of our other partners out there across the border. I'm hoping it's smoother this time around. I have ordered some antigen tests that I can do at home, which is going to be much better than going to a pharmacy or going to a doctor's office. And I'll be able to do it at my own house, on Saturday, hop on the plane on Sunday, and then do it in my hotel room on Thursday and fly home on the Friday during the show. But I'm excited. I know we got a lot of partners and some customers coming down to HIMSS, and it's going to be great because here we have that idea that we shouldn't be meeting in person. But when we come down and go to Florida, these people, they're like, wow, I can do this again. I can have meetings. And I'm hoping that some of that mentality comes back and that we see the confidence in in-person events happening again in Canada. So we haven't had one since November of 2019 was the last live event I attended in Canada. Every event I've done has been in the States.
Well, I commend HIMSS on what they've done. They've been smart with the appropriate use of masks, vaccine requirements. They've put additional air filtration systems into the convention halls, and they are focusing on social distancing. So I think they're taking a responsible approach. As you mentioned, we attended HIMSS in Las Vegas last August. I think it was an extremely successful show. So we're really looking forward to having it in Orlando, Florida. And Phil, I hope you don't have too many complications to get down here. We'll open you with welcome arms. The weather's great. Disney's open, basketball's in full force. So we look forward to welcoming you to Florida when you come down for HIMSS. And we really appreciate you coming on the show today to share your perspective on the things that are happening in Canada as a result of the COVID pandemic. Our guest today has been Phil Jalbert. Phil, thank you for joining the show today. We look forward to seeing all of you again next week and every Wednesday at 3 p.m. Eastern Time live on the Clean Talk Show on the Seal Shield Network. Until then, remember to keep it clean.